Welcome to the Deep Dive, where we slice through the noise and pull out the most important nuggets of knowledge from a stack of sources, getting you well informed, fast. Today, we're diving deep into an experience that, well, it can be one of life's most profound, yet also surprisingly challenging, becoming a new parent. When you welcome a baby, the expectation is often just pure, unadulterated joy. But for a significant number of new parents, that picture isn't always the full story. Sometimes there's this creeping sadness that emerges, kind of an unexpected emotional undertow. That's why we're taking an in-depth look today at postpartum depression, or PPD, and also the wider world of perinatal mood and anxiety disorders. They're often called PMADs.
Right. And it's really important to stress this isn't just about feeling a bit blue for a few days after the baby arrives. We're talking about a serious condition that impacts countless families, honestly, far more universally than many people realize.
So our mission today, for you listening, is to equip you with a really comprehensive understanding. What PPD truly is, how you can recognize the signs, which can be quite nuanced, the absolutely crucial role that partners and communities play in support.
And also the wide array of effective treatments and resources that are actually readily available now. We've sifted through quite a diverse range of articles, research papers, expert insights, all to bring you the most vital information.
And here's something that I think might genuinely surprise you. For many people, what we traditionally think of as postpartum depression doesn't actually wait until after birth.
That's a key point. It can often begin during pregnancy.
Exactly. And it's not exclusively a mother's experience either. New fathers can also find themselves struggling with very similar symptoms.
It just underscores how expansive and impactful this condition truly is. It's not confined to one person.
Right. So let's peel back the layers on this complex topic.
Yeah.
Okay, so to really get a handle on PPD, we first need to define it clearly. What are we actually talking about?
Well, fundamentally, it's a common, but definitely serious medical condition. The stats suggest it affects approximately 1 in 8 new mothers within the first year after giving birth.
1 in 8. That's a huge number. That's so many people navigating what should be, a time of intense connection and joy, often in silence.
It is, and what's really significant here is how the medical understanding itself has evolved. In the DSM-5-TR, that's sort of the official guide for mental health diagnoses, PPD is now classified as major depressive disorder with peripartum onset.
Peripartum onset, so that's not just postpartum.
Precisely. It's not just a change in name. It's a recognition that PPD can officially start during pregnancy or within the first 4 weeks after delivery.
Okay.
And this is really critical for how doctors and therapists work, clinical practice often extends that recognition window. They look at the first full 12 months post-delivery because, realistically, the emotional challenges don't just switch off after 4 weeks.
That broader time frame seems much more realistic. It really redefines that window of vulnerability. So, okay, if PPD is this more severe form of depression, how do we confidently distinguish it from what almost every new parent experiences to some degree, those baby blues? Most people expect some emotional turbulence, right?
Absolutely, and that's a really common question. The postpartum blues, or baby blues, they're generally a transient, much milder mood disturbance. You might see symptoms like crying spells, irritability, some anxiety. These are incredibly common.
Right, the typical image.
Yeah, and they typically develop maybe 2 or 3 days after delivery, and this is key, usually resolve on their own within about 2 months.
Okay, 2 weeks.
The critical difference with PPD is that the symptoms are far more severe. They significantly impair daily functioning, making it hard to care for yourself or the baby. And crucially, they last longer than 2 weeks. That duration and intensity, those are your main indicators that it's likely more than just the blues and really needs a closer look.
It's just astounding, though, that despite how common PPD seems to be, it so often goes undetected. Our research highlights that, up to 50% of cases might remain undiagnosed.
Yes, it's a shocking statistic. And a huge reason for that is often this immense burden of shame or guilt that women can feel. They worry, they'll be seen as a bad mother or even fear being abandoned if they admit they're struggling so much.
It's a massive silent barrier.
It really is. And it brings up important questions about, societal expectations and the often unrealistic, idealized image of new motherhood. While maybe up to 85% of women experience some kind of emotional turbulence postpartum, the actual PPD diagnosis impacts roughly 10–30% globally.
That range is quite wide.
It is, and rates can vary depending on factors like income level, access to resources, even the diagnostic criteria used in different studies. But the sheer number of individuals who feel they have to hide their symptoms, it just underscores a desperate need for, frankly, greater public awareness and a more compassionate, realistic understanding of what new parenthood can actually involve.
Absolutely. So if you or someone you care about has been experiencing these kinds of struggles for more than that 2-week mark, what are the specific signs? What should people really be watching for?
Okay, so key symptoms to look out for lasting more than 2 weeks. We're talking about persistent feelings of anger, maybe?
Anger. That's
Common.
interesting, not just sadness.
Not just sadness, no, anger, a profound sense of hopelessness, maybe debilitating guilt or shame, unusual crying spells or crying much more than usual without a clear reason. Significant, sometimes quite dramatic, mood swings are also common.
And what about physical signs?
Definitely. Noticeable changes in appetite, eating much more or much less than usual. Same with sleep patterns, either sleeping way too much or suffering from insomnia, even when the baby's asleep.
Okay.
Also, a real loss of interest or pleasure in activities that used to be enjoyable, actively avoiding loved ones, withdrawing socially, and persistent irritability is another big one.
It sounds like it really permeates every aspect of life.
It absolutely can. And while those are the common signs, it is so vital to stress there are critical warning signs that require immediate help.
Right. This is crucial.
If there are ever thoughts of self-harm, harming oneself, or, and this is incredibly hard to talk about, but essential thoughts of harming the baby, that is an absolute emergency.
Please seek professional help immediately if that's the case. Don't wait.
Don't wait. Call emergency services, a helpline, your doctor, whatever is fastest.
You know, it's easy to fall into the trap of thinking PPD is solely a mother's experience, but our sources reveal something really critical. It truly isn't limited to mothers.
No, not at all. Paternal postpartum depression is real, and it affects a surprising number of fathers. Estimates are around 8 to 10%.
8 to 10%, wow.
Yeah, and their symptoms can look remarkably similar to maternal PPD. We're talking sadness, profound fatigue, anxiety, irritability,
Even suicidal thoughts.
even suicidal thoughts, yes. And interestingly, paternal depression is often correlated with the mother's depression. When one partner is struggling, it increases the risk for the other.
That makes sense. And what about the unique challenges partners face?
It's a really important area. There's often just limited general awareness that fathers can get PPD too. They might not recognize the signs in themselves. Plus, partners are frequently kind of excluded from the formal treatment plans designed for the mother.
Leaving them feeling isolated, perhaps?
Exactly. Isolated, maybe ill-equipped to help. And then you add the sheer psychological burden of watching someone you love struggle intensely. That can lead to significant distress, burnout, or even depression in the partner themselves.
Man, it's a heavy load.
It is. But here's the encouraging part. The protective power of partner support is huge. Studies show that when partners get involved, maybe attend psychoeducational sessions to understand PPD better, mothers actually report a significant reduction in their depressive symptoms.
Really? Just understanding helps.
Understanding and active support. Strong relational bonds really act as a powerful buffer against distress for both partners. It just highlights the power of tackling this as a team, a united front.
And that protective power, that support for the parents, it's absolutely critical, isn't it? Because the ripple effect of PPD doesn't stop with the parents. It extends directly to the newest, most vulnerable member of the family, the child.
Yes, absolutely. Untreated maternal depression, or paternal depression for that matter, can have really long-lasting, profound consequences for the child. These effects can reach well beyond infancy, into toddlerhood, preschool years, school age, and even into adolescence.
What kind of impacts are we talking about specifically?
Well, looking at the research, these impacts can show up as behavioral issues, things like increased anger, sometimes passivity or withdrawal, noncompliance, maybe aggression. We also sometimes see cognitive delays, potentially including lower IQ scores later on, or issues with regulating attention,
Wow.
and even potentially academic problems down the line, like attention deficit hyperactivity disorder, ADHD, or other learning disorders.
So the stakes are incredibly high.
Incredibly high. And beyond the child's development, PPD can obviously strain crucial family relationships. And in the most severe, tragic cases, it does increase the risk of suicide for the mother.
It's such a stark reminder that when one person in the family unit is struggling, the ripples are felt by everyone, especially the most vulnerable.
It really makes you question how well our healthcare systems are actually set up to support the entire family unit, not just the individual mother in isolation.
That's a really good point. So what about that first line of defense then? Our healthcare providers, like pediatricians or OBGYNs, are they consistently catching these cases?
Well, the good news is our sources indicate that most mothers, actually over 80%, recognize the potential impact PPD could have on their child's health. And they generally accept their pediatrician playing a role in screening for it. They see the connection.
Okay, so the willingness is there from parents.
The willingness often is yes. But unfortunately, the reality is that pediatricians and sometimes other providers too often under-recognize maternal depression.
Why is that?
It often comes down to a lack of confidence, maybe insufficient specific knowledge, or just lack of training in this particular area. It represents a pretty significant systemic gap that really needs addressing.
So how do we bridge that gap?
This is where standardized screening tools become absolutely essential. Things like the Edinburgh Postnatal Depression Scale, the EPDS.
Right, I've heard of that one.
Yeah, it's widely used. A score of 13 or higher on the EPDS generally indicates an increased risk and signals that further assessment is definitely warranted. It provides a concrete, evidence-based starting point for identification. Doesn't replace clinical judgment, but it's a vital tool.
Okay, so it's clear PPD is incredibly complex, affecting the whole family, sometimes hard to detect. What about the causes? For those struggling, what's actually causing it? Is there one single answer?
No, definitely not one single answer. It's very much a tangled web. The exact cause, well, it's still technically unknown. But the prevailing understanding is that it's a really complex interplay of biological factors, psychosocial factors, and even, as we touched on, systemic factors. It's rarely just one thing acting in isolation.
Okay, let's break that down. What about the biological side?
Right, so biologically, we're looking at a cascade of hormonal shifts. Think about the dramatic drops in estrogen and progesterone right after birth. Those are huge changes. Plus, erratic changes in the body's stress response system, the HPA axis. That whole system can get thrown off balance.
Okay, hormones, stress response. What else?
Well, there's also research looking at nutritional aspects. Low levels of certain nutrients like DHA, which is an omega-3 fatty acid, vitamin D, zinc, selenium, have been associated with PPD.
Interesting. How could nutrients affect mood like that?
The thinking is it might involve complex interactions between the brain, the nervous system, and the immune system, what's sometimes called psychoneuroimmunology. Basically, our physical health deeply impacts our mental health. There are also potential links to thyroid issues like postpartum thyroiditis or certain anti-thyroid antibodies.
Thyroid problems, okay.
And perhaps counterintuitively, synthetic oxytocin, the drug often used to induce or speed up labor, has also been linked in some studies to increased rates of PCD and anxiety later on.
Really? That's surprising given oxytocin's usual association with bonding.
It is surprising, and it raises important questions about the full spectrum of effects of even very common medical interventions during childbirth. We don't always know the full downstream impact.
Okay, so there are a lot of biological shifts happening, many beyond a person's direct control. What about the other side of that coin, the psychosocial risk factors, life circumstance?
Yes, those are incredibly important too. The research consistently points to antepartum depression, meaning depression experienced during the pregnancy, as the single most influential predictor of PPD.
So if someone is already struggling before the baby arrives, that's a major red flag.
A huge red flag. It requires close attention and support right from the start. Beyond that, things like major stressful life events happening around the time of birth or pregnancy.
Like moving or job loss or relationship problems.
Exactly. Chronic strain, ongoing conflicts in relationships, and critically, a lack of adequate social support, whether from a partner, family, or friends. These are all significant contributors.
It really hammers home how vital a strong, reliable support system is during this massive life transition.
Absolutely essential. And then if we zoom out even further, we see these broader socioeconomic and cultural dimensions playing a really substantial role too.
How so?
Well, things like having fewer financial resources, low income, or having an unintended or unwanted pregnancy, these all significantly increase PPD risk.
Systemic issues again.
Yes. And things like racism and socioeconomic disadvantages contribute to real health inequities, not just in who gets PPD, but also in who gets screened for it and who can access effective treatment.
That's a critical point about equity.
Definitely. Even specific cultural factors can play a role. Some studies, for instance in the Middle East, found increased risk linked to things like women not feeling informed or involved in childbirth decisions or societal pressures related to the baby's gender.
Wow. These are deeply ingrained systemic issues that go way beyond an individual's biology or immediate circumstances.
They really do, and they require a much broader community-wide response, not just individual solutions.
Now, something really fascinating here is the emerging role of technology, specifically machine learning, in prediction. Tell us about that.
Yes, this is a really exciting and potentially powerful development. Recent research is using these advanced computer models, like one called extreme gradient boosting, to actually predict PPD with pretty impressive accuracy.
How does that work? What are they looking at?
Well, these models analyze large data sets and identify key predictors, which actually reinforces the need for really comprehensive screening. They flag things we've already discussed, like antepartum depression being key, but also things like lower fetal weight, certain thyroid markers like elevated TSH, or changes in TPOAB antibodies.
Those thyroid antibodies again.
Yes, they seem potentially important indicators of autoimmune processes that might affect mood. Also, elevated serum ferritin that's related to iron storage in older maternal age have shown up as significant factors in these predictive models.
So this data-driven approach could give us more precise tools to identify people at high risk earlier.
That's the hope, potentially identifying individuals who need extra support before symptoms become severe and overwhelming. It's early days, but very promising.
And finally, before we move to solutions, there's a very sobering risk factor we need to explicitly mention: the link to violence.
Yes, unfortunately, this is a significant factor. Violence against women, whether it's physical or sexual violence, dramatically increases the risk of developing PPD.
How much does it increase the risk?
Some studies indicate that individuals who have experienced family violence are about 2.5 times more likely to develop PPD compared to those who haven't.
2.5 times.
Yeah.
That's a profound and tragic correlation.
It really underscores the devastating impact of violence on mental health, particularly during such a vulnerable period.
Okay, so given this really complex web of causes, biological, social, systemic, relational prevention, and early intervention seem absolutely critical. What are the key pathways to healing?
They are critical. The U.S. Preventive Services Task Force, the USPSTF, actually recommends evaluating all pregnant and postpartum women for depression risk. And for those identified as high risk, they recommend referral for counseling interventions. It's a proactive approach.
So screening everyone is recommended.
Ideally, yes. Beyond screening, other important preventative measures include things like positive parenting education, programs that promote strong parent-infant bonding, and, as we keep mentioning, ensuring robust social support is absolutely crucial. Interestingly, even exclusive breastfeeding has been linked in some studies to reducing depressive symptoms for some mothers.
That's interesting about breastfeeding. Now, we touched on partners earlier, but it feels worth circling back to those practical steps.
Yeah.
What can partners do?
Yes, let's reiterate those because they are so impactful. Our sources highlight about 7 key ways. First, simply know the signs of PPD so you can recognize them if they appear.
Okay, awareness first.
Second, help with tangible practical needs. That means pitching in with chores, running errands, taking over some childcare shifts, maybe helping set boundaries with visitors if needed.
Taking things off her plate.
Exactly. Third, and this is huge, do whatever possible to ensure the mother gets adequate sleep. Sleep deprivation is a major trigger and exacerbator of mood issues.
So important, so hard with a newborn.
So hard, but crucial to prioritize. Fourth, gently encourage and actively support seeking professional help if needed. Help make the appointment. Offer to go along, reduce those barriers.
Be an ally in seeking help.
Absolutely. And finally, number 5, and this is vital, partners need to take care of their own well-being too. You really can't pour from an empty cup. Monitor your own stress levels, seek support if you need it.
That self-care piece for partners is often overlooked.
Definitely. Okay, so when professional help is needed, what does that look like? What are the main therapeutic approaches?
Right, what works?
Psychotherapy or talk therapy is generally considered a highly effective first-line option. This can take different forms: individual counseling, group therapy, even home visits, which can be incredibly helpful for new parents who find it hard to leave the house.
Home visits, that's great.
Yeah, and a really powerful insight here is that effective interventions don't always require a highly specialized psychiatrist. Trained nurses, midwives, even lay counselors can deliver effective support, which significantly expands access to care.
That broadens the possibilities. Are there specific types of therapy that are particularly good for PPD?
Yes. 2 well-researched approaches stand out. Cognitive behavioral therapy, or CBT, is one. It focuses on identifying and changing unhelpful thought patterns and behaviors that contribute to depression and anxiety.
Changing thoughts and actions.
Exactly. And the other is interpersonal therapy, or IPT. This one specifically focuses on relationships, improving communication, resolving conflicts, navigating role transitions. It feels particularly intuitive for PPD, given the huge relationship shifts that happen with a new baby, including that crucial mother-infant bond.
That makes a lot of sense, focusing on relationship.
hmm And speaking of access and innovation, we should definitely talk about digital health.
Right, the online options.
Yes. Internet-based CBT programs, there's one called Mum Mood Booster, for example, have shown really promising results, especially when combined with some low-intensity human coaching or support. These online programs have actually been shown in studies to be statistically superior to traditional face-to-face CBT and standard care in reducing symptoms.
Superior. Wow, that's significant.
It is, and it's a potential game changer because it can overcome so many barriers like long waiting lists for therapists, the cost, geographical distance, or just the sheer logistical challenge of leaving the house with a newborn.
Makes help much more accessible. What about medication options?
Medication is definitely an important option for many. Antidepressants, particularly the class known as SSRIs or selective serotonin reuptake inhibitors, are often recommended as a first line.
Like sertraline.
Exactly. Sertraline is a common one. A key benefit, especially for breastfeeding mothers, is that very little of it typically passes into breast milk, which is obviously a major consideration.
That's reassuring. Are there newer medications?
Yes, we are seeing newer treatments emerge. There's actually a new oral medication that was recently approved specifically for PPD, which is a big development.
Okay.
And for moderate to severe cases, there's also brexanolone. This is an intravenous medication, a type of neurosteroid. It offers very rapid relief from symptoms, which can be critical in severe situations.
Rapid onset sounds good, but intravenous.
Right, that's the catch. It requires a continuous 60-hour infusion in a hospital setting, and it's generally not recommended for mothers who are breastfeeding during the treatment and for about 4 days afterward. So it's a significant intervention reserved for more severe cases.
Okay, so therapy, digital options, medications. What about lifestyle strategies? Do those help?
Absolutely. Lifestyle and complementary strategies can make a substantial difference, often used alongside formal treatment. We're talking about incorporating regular, light aerobic exercise, even just walks can help. Maintaining a balanced, nutritious diet is important too.
We mentioned those nutrient links earlier.
Exactly. Engaging in mindfulness practices, meditation, or deep breathing can help manage stress and anxiety. And critically, actively connecting with supportive friends and family, fighting that urge to withdraw.
Connection is key.
Connection is absolutely key. And just to reiterate the nutrient point, while there's that potential link between things like omega-3s, vitamin D, zinc, and selenium and PPD risk, the evidence for supplementation actually treating PPD is still a bit mixed. So diet first, supplements may be under guidance.
Got it. So diet, exercise, mindfulness, connection. And what about community support? Finding others who understand.
That is such a cornerstone of healing and recovery. Knowing you're not alone is incredibly powerful. Organizations like Postpartum Support International, or PSI, offer truly invaluable resources. They have free helplines. That number is 1-800-944-4773. They offer tech support. They have an app called Connect by PSI.
Wow, lots of ways to connect.
Yes, and they run free virtual support groups for parents, for partners, specific groups for different needs. These provide such a vital sense of community and understanding for people affected by PPD and related disorders.
That peer support sounds crucial.
It really is. And sometimes support comes from unexpected places. The source material even mentioned how environments like Montessori education, for instance, can indirectly offer a supportive, flexible space for both mother and baby just by providing new moms with some much-needed time, structure, and peace during the day.
Interesting angle.
Ultimately, though, overcoming the bigger systemic barriers means we need ongoing, diligent work. We have to reduce the stigma around maternal mental health. We need to improve access to comprehensive mental health resources for everyone. And we absolutely need to ensure effective, coordinated care between different professionals, OBs, pediatricians, mental health providers, so new parents don't fall through the cracks.
The interprofessional coordination sounds vital. Well, we have covered a lot of ground in this deep dive into postpartum depression, from really understanding its complex, multifaceted origins and its varied symptoms, to exploring that whole range of effective treatments and the absolutely crucial role of support systems.
Yep.
I think the main takeaway is crystal clear. If you are struggling, you are absolutely not alone in this, and help is profoundly available.
It truly is. Recognizing the signs in yourself or someone you care about, taking that courageous step to seek help. And for those around someone struggling, providing unwavering, informed support. These are such powerful steps toward healing.
Towards healing and truly thriving, not just surviving, as a new parent and as a family.
Exactly.
So as we wrap up, here's something to leave you thinking about.
Despite this increasing awareness we've discussed, despite the growing number of treatment options and the clear, profound impact PPD has on families,
Hmm.
the United States stands out, quite starkly actually, among 41 developed nations for uniquely lacking any form of federal paid parental leave.
A significant outlier.
A very significant outlier. And this absence often adds just immense financial and emotional stress onto new parents during what is already one of their most vulnerable times.
So here's the provocative thought. What if? What if universally available comprehensive paid leave became a standard, a societal norm for all new parents, mothers, and fathers?
How might a systemic change like that fundamentally alter the landscape of PPD prevention and support? Not just for mothers, but thinking about paternal PPD too, and the healthy development of their children.
And perhaps what role do we as informed individuals, as a community, play in maybe advocating for these kinds of vital changes for future generations?
Yeah.
Something to definitely mull over.